You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, what you need to know if you have low back pain or back pain and or knee pain. We're talking about some of the non-surgical approaches, and with us we have Los Angeles, the go-to center for back pain and knee pain. With us we have Dr. 𝐬𝐨𝐫𝐞 Britton. Dr. Britton, welcome to the program.
Hey, thank you very much. It's a pleasure to be here, Andy.
Now, your center, West LA Medical, Arthritis, Neuropathy, and Disc. What's the right way to say it?
You know what? It's West LA Medical, Arthritis, Neuropathy, and Disc. We just wanted to make it easy for people to know what it is we're going to help them
Okay,
with.
good. Now, we're going to go into back pain and what you're doing and what some of the newer things you can do. And then we're going to go into knee pain as well. But who's your typical patient?
My typical patient is someone who, for some bad reason, has already had surgery. They already had surgery and now...
Back surgery.
Back surgery.
Okay.
And now the pain is coming back, right? People were like, oh, it was hurting. The surgery seemed to work. 4 or 5 years later, now it's coming back and they don't want to go through it again, or they don't want to go through the rehab, or they were told to do the back surgery, do the fusion, that would help with the nerve compression. Now the pain's coming back. It's already fused. What do? They come to us.
So that's one of the things you do. Okay.
Oh, yes.
Okay.
100, because the body's an open circuit system, meaning sometimes your pain, especially for people after they've had surgery, right? That pain isn't just a function of the mechanics or the orthopedics. That pain is a function of the cycle, almost like a safety pin that the brain, the body, the hormone system, and the neurological system are all managing. And when you get bad signal coming back to the brain, there might not be that injury there. There's nothing for the surgeon to look at an MRI. There's no nerve test for him to do because the circuit's coming up. And what's incredible, because I'm here in the heart of UCLA area, UCLA territory. But really the breakthrough in research came 20 some years ago in UCSD. A guy named Ramachandran realized he had soldiers coming in, arm blown off or leg blown off, and they say, doctor, my foot hurts. It hurts really bad. And he's like, you got no foot there, so what's wrong with you? And they have no answers. And Ramachandran figured out, hey, the brain's waiting for a certain set of signals to come back in. They're not coming in. And just like a mom waiting for their kid to get back home after the school bus, till that school bus comes, she's not comfortable, your brain's not comfortable.
So you can help non-invasively kind of change that signaling to the brain.
Yes.
So they don't feel pain.
Yep.
So are there people that, again, they had surgery, they're starting to get pain that's coming back. They've been told they need another fusion or some type of surgery.
Yep.
Do you have people that you've been able to get out of pain?
We have.
That go
that's
away?
Happening every day.
Every day.
I mean, Randy, it's just I don't want to strain credulity here, but every day at our office, people are getting out of pain that never thought they'd be free.
Okay.
And I tell my life shouldn't be about getting out of pain. Your life should be being a great father. My life should be being a great artist, or if I'm an engineer, doing that. And I think we've now gotten to a part in the world where people are just used to trying to get out of pain. And I'm like, golly, that's not what God brought you here to do. You're here to be expressed. You're here to go have fun. You're here
so they come to you with very low goals. They just want to be out of pain.
Really low, yeah.
So they're back like playing tennis, hiking,
so they get a chance
golf,
to go back and just imagine, you're 55, you finally worked really hard, now you can't play tennis because your shoulder's out? And they tell you got to have surgery on it, and what you're going to take is 6 months or a year of rehab, or let alone the people with the low back or knee pain. I have one patient, he literally was just down the street in the ER, and one of the things came up, and he found out about us, and he left the ER, came to us. We saw him that day, got evaluated, got him in for MRI, and then the next day he got him back. That's how quick our system is. We can get people in, get your x-ray, get your MRI. We can get you in that first day. The big deal is making sure you're informed, and that you know what's going on, so that you and your loved ones can actually, feel comfortable with doing something different. Now,
so you said the first group of patients you get are people that have already had surgery and the pain's coming back.
Yeah.
The second group are the people that they've got some severe problems that they were told maybe you need surgery.
Yes. And what that comes to me is a lot of times people who are big time, like athletes when they were younger, now they're hitting 35, which as almost 50-year-old, I don't feel like that's old, and they're told now they need surgery for their knees. Full knee replacement, no cartilage. Listen, sometimes that is accurate, but a lot of times your body just hasn't been given the ability to heal. So that's why you hear about things like decompression. We put you on a machine. It's really complicated, but I try to make it simple for people, right? You're walking around your knee, so there's always pressure on there. That means your body has always got to create blood cells and blood vessels to get healing factors down there.
Okay.
And then they don't. So what we're going to do is I'm going to get you out playing again in a couple days, because just by coming to my office, I'm going to take about a month's worth of wear and tear off that knee. It's not complicated. I want you to go out and play tennis. I want our people to be able to have fun and focus.
Now, for people just tuning in, I mean, you said earlier you're aggressive with pain. I mean, you're using lasers.
Yeah.
You're using stem cells or growth factors in the area.
Yep.
You're using spinal decompression. What am I? What
You're
else
not
am I-
missing. So here's what's awesome. We're going at it from all these different points of view, from the neurological point of view, orthopedic. So when we're using laser's got some specific things that's been proven to be able to do.
Okay.
And when we're trying to do it, it helps to get down the inflammation. And anytime you try to heal something, you got to get the inflammation down as quick as possible. So you can find on PubMed that laser is shown to be almost or more effective than cortisone injection. Imagine not having to get a drug and having something that's not invasive be able to bring down your pain.
Do you have people that have been able to slowly wean off the pain medications they were on?
Yes, and that's one of the great reasons for us being also interdisciplinary. Our orthopedic surgeon and our nurse practitioner can help wean them off of it. And that's usually you don't have anybody talking to you day after day or week after week, so you can actually feel like you're not just dropping and being your own doctor, but you actually have a relationship.
What's the easiest thing that you treat, in your opinion?
Man.
I don't want to call it easy, but I mean,
I'd say
there a particular...
sciatica.
You
Honestly,
like sciatica?
I love sciatica. Why? Because most of the people...
That's leg pain.
Leg
Stuff
pain
going
is coming down your leg, and you can't stand on it. It hurts when you're trying to drive, and it ends up being a condition that really stops you from jogging, makes driving uncomfortable, hurts when you sit, terrible to wake up to, and so people find their whole lives disrupted from it.
So you are seeing reversals in sciatica?
We're seeing it all the time. Now,
Where the pain goes away?
I had one guy, had pain for almost 2 years. Came in, again, not everybody's a candidate. We end up doing the analysis, saying we found the source of the pain, and we're able to fix it. The analysis is everything, though, Randy.
That's what the challenge, like finding out, as you guys call it, the pain generator?
You're right, exactly. If you don't find out the pain generator, it can be hormonal, endocrine, which is the endocrine system. It can be immunological, like autoimmune. It could be orthopedic, which is where most all PTs, chiropractors, and pain physicians are doing, right? The bone and the cartilage, the bone and the cartilage. And then you have a few docs who are doing the nervous system. But when you realize how many versions of that there are to analyze before you tell a patient I can help you or not, then the doctor needs to show you, or the group needs to show you, that they're looking at those perspectives. We're actually talking to each other every morning about what's going on, so that way it's cross,
Neuropathy. Let's move there. I mean, we're jumping around a little bit.
Yeah, no. I love it.
Because I have a lot of questions here. I told you, one of my friends, he's 55 years old. He's standing on his feet all day.
Yep.
And he says, neuropathy, there's nothing I can do. It can never go away. And I called you. I said, can you really reverse it?
So
have you seen reversals?
I've seen reversals in the symptoms. When we're looking at neuropathy, you're kind of looking at a difficulty of oxygen getting to tissue.
Like the feet, right?
The feet, yep, they're down there. Okay. They're at the bottom. You're standing on them all day. But generally what's happening is that these people who have neuropathy, the pain keeps them from sleeping, keeps them from walking correctly, and drugs aren't working. Drugs aren't working. Otherwise, you just hear this neuropathy drug. Why? Because we're trying to grow tissue. Drugs are made to block pain. Okay. Without the tissue that you need down there, like the blood vessels, your own healthy stem cells, your own growth factors, and your ability to moderate your own inflammation, you're not going to fix it. So we end up having to look at the person's diet, their emotional, and...
So like an anti-inflammatory diet?
Yep, exactly. Looking at, especially the anti-inflammatory diet. Stop starting fires. You don't have to get a firefighter to put them out.
Okay.
And when we use the laser on it, it has great effects, especially in diminishing some.
You even use hyperbaric oxygen.
I love hyperbaric.
You've heard of neuropathy too, or no?
Yeah. Oh, definitely. So, at the degree of severity, we need to get oxygen into somebody. So we're using hyperbaric oxygen chambers. There's a thing they called a pandemic that sort of swept through this country and this world. So we end up dumping the hyperbaric oxygen tank and getting a ventilator that gives oxygen. So this is like 4 times more powerful than even hyperbaric. So we're able to get results and get oxygen into people while we're doing all the other things, because it's a multimodal approach. I'm not going to set up an oxygen clinic. I'm not going to set up a laser clinic. I wouldn't even set up just a PRP or injection clinic. What we want to do is have everything that the body needs to try to get better. And then we're going to apply that in an organized fashion, so that way we can most target what's causing the pain generator.
Number one thing I guess people go to doctors for is pain. Let's start with back pain.
Yeah.
Like, who's the typical back patient you see, especially after they've already had surgery? Is it typically a fusion surgery? Or some other back?
I'm seeing a lot more disectomies nowadays.
Okay.
So disectomy where they do a small incision to take part of the disc off that's pushing on the nerve. And then I'm seeing fewer fusions actually, but the fusion surgeries by the good doctor. Like some of these docs are really great with their fusion surgeries. I'm seeing less and less. And I don't know if that means they've gotten better.
Okay.
Or if it's because more people are doing disectomies.
So most surgery is to just kind of keep things from hitting that nerve.
They really
Is that
are.
correct?
Yeah, they really are. It's keep it from hitting the nerve. It's to stop something. It's a context of the body is broken.
But can you do it non-surgically?
So
means,
when we
are
do it-
you keeping
yeah.
it away from the nerve?
The way we end up doing it is like we use this machine called a spinal decompression machine.
Okay.
And it'll stretches to help fluff up the discs, so the compression that's happened in either the disc or the surrounding tissue
That's making it bulge and
that's
hit a
making
nerve?
the bulge exactly
Okay.
to get that bulge off of it. Now, that's why we end up needing the laser to end up helping stabilize the inflammation in that area, meaning bring down the pain while you're going through the decompression. But generally, the body wants to heal. So our job is to figure out, before we take charge, you start you under care, is your condition one that can be fixed non-surgically? And I say that's what makes us experts, is that we
Okay.
can tell you we can fix it before you have to get committed.
So with a high level of predictability,
Yeah.
before you take on a patient with these natural approaches, I'm
Yep.
calling it natural approaches.
No, I love it. I love it.
That-
I think technology can be natural.
Okay.
You know, because it came out of us. We're looking at the human body, like we're examining, wow, how do chromosomes work? Wow, how is this pain generating in your head? Wow, look at how this is affecting your emotions, how it's affecting your state of mind. Then it's all part of one thing. And we're asking how. Now, once we use technology to figure out what's happened, all we're doing is trying to find out Mother Nature had you designed to do like this. You need more oxygen there. She said you need more B vitamins. She said you need more space in this disc, so we're pulling it open so it stays open. Your knee has now got too little cartilage because of the friction. What we're going to use is the decompression to open that up, let fluid get in there, and then give you exercises. And now your hyaluronic acid injections can make a difference because it's not under pressure. Now when someone does something like what's called PRP, that's where they take your blood, they spin it, when we separate your blood from the healing factors in there. Okay. Right now, all of a sudden, you've taken something that already shows effectiveness, and you've added a orthopedic aspect to it of decompression, and then we're going to go with technology, use the laser to even speed up how that body and that knee is dealing with the inflammation. So to me, that's all within the realm of nature. We're trying to help nature. That's our job.
Okay, so let's say somebody has back pain.
Yeah.
Okay. And are you doing injection therapy? Are you doing the laser therapy? Or
So
is it all
the
above?
answer is all the above. Good job. Yeah, the answer is all the above, right? You come in, I have a 56-year-old male truck driver. He's always driving, doing UPS and things like that, you know, and he's coming in, and he already had back surgery when he's 35 and now he's 50. So it lasted for 20 years. And he realizes, oh man, I don't want to be under the knife now I'm 55 and see if I can even drive again after that. Is there any way you can help me? Well, this is two great things. One, if I can help him, we come in, we do an analysis. If I can help him, he gets to go right back to work and he doesn't have to take any days off. And he doesn't have to worry about his body's been cut open and do the rehab. Two, if I can help him, then that means surgery wasn't necessary. And that was the only thing anybody was telling him. That means he now gets to believe in his body. He gets to believe in that he can actually generate and be his stability for his family and for his life. And I think so, even though there's a medical side, there's an emotional side to it too, of being able to trust your body and trust what you feel inside, that you know you can do this.
So that truck driver, okay.
Yeah.
So he was headed back for surgery.
Yep.
Or that was maybe the path he was going to be on.
That
Or
was the
lots
path
of
he was gonna go on.
medications.
Yep.
So you were able to do what? And
So
how did it work out for this
we
guy?
started out, honestly, for patients like that who are under severe duress, we usually start out by using laser so we can see if we can change that pain. After we've seen the MRIs and x-rays, right? We're looking at, can we change that pain? If we see that laser starting to change it, then we know this technique called PRP is going to be even more effective than that, because that's just what's
That's an
studies
injection
showing.
therapy.
That's an injection therapy,
Okay.
exactly. So the theory of the injection therapy is that basically when you spin and you separate the healing factors from the blood, the way the papers and journals are writing it up is that you've now concentrated the healing factors, the white blood cells, into a small vial, and you're injecting a high concentration into a small space of tissue. And that's what allows that tissue to now take the healing powers and now help regenerate or fix whatever was going on, which was under the body's normal control. And that's without drugs. So you take that theory, you take what the scientific journals are saying about that, and then you add on what they're saying about what you should do using laser. And then you take that piece and you go, well, what else should you do for a muscle or a nerve? You should stretch. And now we can put the PT in on top of that. So we never said don't do PT.
We're physical therapy.
Physical therapy or chiropractic, whichever you end up using. And taking already proven technology that's usually spread out. You go to this doctor for this thing, this doctor for another thing, this doctor for another thing, and this guy's supposed to... No way. There's nothing more unlikely in your life than 5 doctors communicating in 5 different hospitals. There's almost nothing more unlikely.
Do you talk like this with patients?
Are
you excited like this all the time?
I do. You know,
so it might be like a placebo effect too.
You know what?
Like Dr. Britton thinks it's going to work out.
You know what? I wondered about that.
There might be a component of that.
You know, here's what I will give you, Randy. Do you believe that human touch is healing?
Yeah.
Do you believe that communication is healing? I do.
Okay.
So you know what? You cannot be a patient in our office without having a lot of communication. We want to know about what's going on in your life so we can personalize the plan for you. And so if there's a placebo effect, you know what? I don't charge extra for it. But here's what I am. I refuse to fuse. We refuse to fuse.
To do fusion.
Yes, our goal is can we stop people from needing surgery? Here's what's awesome.
And what do the medical doctors have to say about this?
You know what? Here's the thing.
I should say that like the orthopedic surgeons, the neurologists, the spine surgeons.
You know, I'm very surprised at it, but you know what? This is what they wanted to do, Randy. I mean, honestly, when they were little kids, then did all the work to get to med school, and then went and did their residency, they wanted to help people the most effective way they could. And unfortunately, they're stuck in an insurance-based system with lots of bureaucracy, lots of this, that, and it's all about the money. And they really would love to get out and just be able to practice like we're practicing.
You said something to me on the phone about that, and we're short on time, but it's like, if you have a lot of money, a lot of cash, you get these type of treatments. And so these type of therapies we're talking about, whether it's oxygen, hyperbaric oxygen, PRP, laser, stem cells, growth factors, decompression, was really for the rich and famous, or for professional athletes.
I've signed enough.
You said the
NDAs.
NBA, things like that.
Yeah,
they're all doing
athletes are doing it. Yeah. It's of course it's natural that people with money are having it. That's why I think our clinic is really special, because we're making it so we can help people get into it affordably. Not declare bankruptcy is medical expenses is one of the biggest causes of bankruptcy in America, and we're fighting that too, because we're making it affordable.
Now, and that's what my spine surgeons that come on this show complain about off camera, which is, I'd love to do this, all these other injection therapy, especially stem cells or PRP, et cetera, but insurance doesn't like to pay for it.
They don't.
In many states. And they do charge for that, but you've figured out a way to make it affordable.
Well, here's what we do.
There's even financing.
We have to analyze you. So we let you come in $39.
So $39.
They can get analyzed. And because if I say we can take you, I mean, we'll take you saying
so it's like an assessment, it's an evaluation, and then a strategy to get them better. And then they make a decision.
And then they make a decision. Yeah. It seems like the most natural thing to me. It's just sad that healthcare's got to the point that straightforward process isn't what people are used to anymore.
Okay, knees. We got to talk about knees. You're like the knee guy. I was almost going to call you the knee king.
Oh, man.
But for people with arthritis, I thought there's not much you could do. And also, I said to you, like bone on bone.
Yeah.
You can deal with that. So what are you doing for knees?
Sometimes people are being told they're bone on bone because they're really close to bone on bone, and the doctor didn't feel like explaining the difference between completely bone on bone or not. He's like, they're not going to pay if I don't tell them it's bone on bone. I know it sounds terrible, but I think that some of them, it's not really bone on bone. What we have is there's enough cells left, enough cartilage cells in there, a few, that if we give enough, take off the pressure.
You could grow back?
They could start, exactly. Well, you're always growing or you're dying.
Could you prove it on an x-ray, like a before and after?
So we do
people
that.
Like ligaments or tendons or whatever are getting bigger?
All of our patients, we do pre and post. So everybody who's walked out there and left a review or not left a review, whichever way it went, they've had a pre and a post of their knees. Now,
X-rays you're talking about.
X-rays or MRIs, whichever is the actual, the indicated imaging. So that's why I say it's not because I'm bragging. I'm very meticulous. I'm super OCD. I want to see that you got better. If you didn't, then let's keep searching, or maybe we were wrong and we're going to find you who you need to be with.
Can a person go back to running that couldn't run at all with bad knees?
Yes. Oh, yes. Now, are you talking next week? No. Are you talking 6 months? Closer, yes. There's just things that get in the way of them knowing that they're safe to do it. And so if you came in and we were talking about your knees, we'd really talk about your goals. Are you running as running necessary? Or would you like to be able to walk long periods of time? And you got to get those goals down. Now, marathon runners and these triathletes, man, they've been bone on bone for 8 years, some of them. Okay. You know, they can tell you, I got bone on bone, I still run. So I'm the doctor for them. I'm the guy who makes sure that that doesn't turn into infection or inflammation.
And arthritis?
Arthritis, especially from our point of view, we're looking at arthritis from the idea of the loss of the healing factors for the bone or cartilage. So what would that be? That means blood vessels, red blood vessels, and then your own body's healing factors. So if we replace those and get those back in there, guess what? The symptoms that you have from arthritis start to go down. And then now you can walk more, you're getting more fluid in there.
Okay.
The less movement in a joint, the more likely for it to get diseased. A joint needs to be moved. It needs motion, it needs fluid, it needs activation, it needs innervation from the nerve. Those are all the things besides just physical therapy or cracking them with chiropractic that will add to getting to that pain generator you spoke about.
You say if I sat in your waiting room,
yeah,
I would see every single day of people, so-called miracle stories.
You'd see two doors. The door of the new people coming in, like on their crutches and wheelchairs, saying, oh my God, I don't even believe it. I've seen everything, but my wife said I gotta come. To the other side, where people are walking out, bye, hi, have a happy new year.
Sounds like an exaggeration.
I know, it's not. We made a really fun, and that's why I showed you that we've got a
I mean, not
3D.
everybody gets better.
I'd say
but a huge percentage.
A huge percentage, but
better.
Again, it's biased. I don't let you in if I don't know what's wrong. I mean, that's so cool. I don't let you in if I can't find what's wrong. I'm not a guesser anymore. So that's where we get that. So you say, you might send me 200 people, and I'll take 50 of them.
Okay.
And of those 50,
not everybody's a candidate.
That's what, yep.
So $39 gets you in. That's the whole evaluation.
Yeah.
Did they get to see you on that?
So some people will, some won't. We've grown so much now. We've got patients coming from wherever, but I do directly manage every single case. You will see me during your treatment, and right now, you'll probably see me if you call in during your actual initial exam. So,
okay. Now we haven't talked about shoulders. I mean, you do shoulders, you do neck pain, back pain, knee pain. It's all of those things. Right?
We do all those things. And again, you know what's nice is we're still talking about human tissue. That's why human tissue grafting or human tissue replacement is such a big deal. And that's why that specialty is one that I think is new even to orthopedists or even to neurologists, because you're really looking at farming, growing that tissue in there, helping the patient do what's best for them.
We literally are out of time. But we're talking about stem cells because it's very interesting. We're not even supposed to say stem cells.
Yeah.
But there are real stem cells from babies like the cord.
Yep.
Then there are stem cells from PRP, which aren't really stem cells. It's kind of growth factors.
Yeah, I can break it down real quick. When you do PRP, you're going to get stem cells, which is going to be like 50 to 30,000. The real part of PRP is actually the healing factors from your own body. But some people are looking at stem cells for regenerating brain, kidney, liver. We don't do that. That to me is high level stem
from
cell.
the marrow.
You got
bone
it.
marrow. Okay.
Bone marrow. We're just using from the cord.
Okay.
We're just using from the cord. Minimally, they haven't been, what do they call it? Minimally adjusted. They're connected to their tissue, and we're literally, what they're looking at is they put tissue on tissue, and your own tissue ends up bringing that in and growing with it, like a skin graft.
Okay, so you're a big fan of that. And what do you call it? What are you allowed to call it? Just, do you call it injection therapy? What do you call it?
Human cellular tissue treatment.
Okay.
Human cellular tissue therapy is the.
Because Google won't even allow you to put stem cells on anything.
No, I don't know how people are even finding it. Like, they're finding us because we're pain solvers. We solve the problem of pain, and that's one of the things we do.
So it's a big word of mouth business you're in.
Right now, it's big. I mean, our office is, I'd say, 80%
Would you
referrals.
say there's tens of thousands of people within an hour of your practice that are in pain that don't have to be?
Oh, yeah. When we do analytics, it's like 250,000 people at any one time. 250,000 people within like 5 miles.
Are in
10
pain
miles.
that don't have to be.
That don't have to be.
You know, people
Everybody
in pain can be stubborn. Most doctors tell me that I've interviewed, they don't like the pain patients. Why do you like them? And we've got about 45 seconds left.
I like them because they have a focus. They want a result. As long as I can provide that result, everything's good. They don't want to talk about this, and we get in conversations about why the drug company. Listen, I'm not going to stop the drug companies. They're way bigger than me. They want to say, can you fix my knee? Can you fix my back? Can you fix my shoulder? And our answer is yes.
In most cases.
In most cases, yeah. After we do an analysis, yeah.
Now, when you say yes, you think you could do it, that's based on your opinion, based on the imaging, the MRI, the X-ray, whatever.
Yeah, when I'm saying
is
yes,
that part of the $39
That's
thing
part of the $39.
So for $39, you get all of this, and you get...
We don't cover, you got to pay for because some people have insurance that covers their MRI. Their imaging, they have to pay for separately, but they get about 2 hours of me and my staff's time for $39 to actually do balance, look at brain, look at blood work, look at all that stuff.
And with a high level of predictability, you could say, we think we could do it.
Yep, exactly.
And they get their life back.
That's what I'm out for.
Because, when you're, look, I was in pain, I think I told you, just with sciatica.
Yeah.
When you're in pain, you're not in the mood to do anything.
Nothing.
You're not optimistic. You don't want to start a business. You don't even want to listen to people.
Randy, you get the big idea. That's the big idea I've been preaching. If we're in pain, all of our decision-making levels, let's just say, goes down by 1 notch. I don't know about you, but I can't afford for my decision level to go down 1 notch, let alone 2 or 3 because it's extreme pain. We're going to change the world if we can get them out of pain. They'll be different people. It's a different life.
They're fun to be around.
I think...
you say the family's affected too. Like when you get them out of pain, the family...
One of my biggest
is happy because they're not so miserable.
Recently, we had a young lady start. She had been diagnosed with lupus and MS, and it kept going back and forth. No one could settle it down for some reason. And when they came into us to talk about it, we looked at the imaging. We actually looked at the nerves going into her brain, passed it over to an orthopedic surgeon. We looked at what was happening orthopedically up there, and we came up with a solution with her. And it included a little bit of everything. But guess what? It was her mom crying that brought me. It was like the daughter's like, I'm moving around, I'm having, but the mom's like, I just thought I was going to die. My daughter's going to be out in this world, nobody helping her, with her body falling apart. And now I believe she can at least live a better life. She's a lot better. Yeah. Yeah. She's one of our big success stories.
Okay, good. And you're all over the internet. I mean, you've got patient testimonials.
We have to.
You got a lot of, you got videos all over the place.
If we don't get the message out, listen, Randy, there's about 200, if you spread out through this country, I have 200 colleagues that are doing this level of multidisciplinary, like really diving in. We're trying to know it all. Nobody can know it all, but we're trying to master all the different aspects. And that's taken for me 16 years of life to put together the 4 certifications I got, 16 years, and there's 3 more I'm trying to get. Why? Because if you could see the whole big picture, now I can direct a surgeon. Now I can help shape what the PT or chiro's doing. There's a world where managing it is super important, and each human being might need 5 people to manage their pain.
Okay, good. We're out of time. I want to thank you for coming on the show.
Thank you.
Okay, so if somebody wants to make an appointment, they go to the website. You say it's a $39 special you're running.
Yep, $39 special we're running.
And
our website is West LA Arthritis and Neuropathy.com.
All right. I want to thank you for coming on the show. Good stuff.
Thank you so much. I appreciate it.
Appreciate it. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.